We have often heard that many of us who get H1N1 have underlying conditions that put them at serious risk. So what exactly does that mean? Some confusion out there. And joining us this morning is Dr. Naomi Kistin with the State Health Department to help explain. Good morning, Doctor. Thanks again for being with us.
Good morning.
All right, let's talk about underlying conditions. What are some of them?
Okay, first of all, as people know, underlying conditions are things that make a person more likely either to get flu or, if they get flu, to be sicker with it. Some of these conditions are the same underlying conditions that are a concern every year with seasonal flu. People with chronic health conditions, people over 65, people with conditions like diabetes, asthma, chronic lung disease, cancer, liver problems, heart problems, not high blood pressure, but other heart problems, children under 19 who are on chronic aspirin therapy, people with neurological problems that might make it hard for them to handle secretions or mucus if they did get a lung infection.
Could you say anyone that's taking medication on a regular basis, or is that just maybe all too consuming?
I would hesitate to say that.
Right. What about someone who has a cold? Would you call that an underlying condition?
No, I would not.
Okay.
But if someone with an underlying condition starts to get symptoms of flu that include fever with a sore throat or a cough, and then some other symptoms that people are probably familiar with, like muscle aches or fatigue, then people who have the underlying conditions need to act sooner than other people.
You're kind of concerned that people might panic a little bit here if they're listening to us, if they have, if they're diabetic or something like that.
Well, I want to stress that not everybody with an underlying condition will get the flu, even if people in that group are more likely to. And not everybody who gets the flu, even if you have diabetes or asthma or these conditions, will get super sick with it. I've talked to a lot of people with asthma or diabetes who are worried that if they get it, it's automatically sure they'll have problems. All we're saying is there's an increased chance of problems when you have some certain conditions.
All right, so you have an underlying condition, one of these that we have talked about. Do you need to take extra precautions then?
Well, the main thing that we're saying to people who fit into these groups, and the groups I mentioned are true for seasonal or for H1N1. H1N1 has some new groups because a novel virus tends to go after younger people. So parents of children under 2 are also included in the group of people that need to be a little more cautious. So what we say is that if a normal healthy person gets a fever and cough, we say they have a flu-like illness and they can watch it for a day and see if it gets worse. If somebody in one of these groups gets a fever and a cough or a fever and a sore throat, we think you should check in with your provider on that day, see if you need some antiviral medicine. It's really just acting early.
Stay on top of it.
Yeah. And this group would be more at front of the line to get the antivirals than other people. But yes, stay on top of it, act that day if you get flu-like illness.
We have just a few seconds. How is New Mexico doing? With we don't have enough doses. Generally across the country, there aren't enough H1N1 doses out there as far as the vaccine. That's the same case in New Mexico?
New Mexico is receiving vaccine proportional to population. We're all dealing with that. And again, we ask that folks in these groups act first, and we'll act first with you. As soon as we have vaccine, you're the front of the line.
Dr. Kistin, again, thanks so much for being a regular guest on our show. We really appreciate it.
Thanks for having me.
You bet. Back with